Darien Sutton. Good morning, Dr. D.
Good morning. Good morning.
It's
Good
the
morning.
only
How
way
are
I
you?
can do it.
Good morning.
I'm good. Now, New York, as we know, is the epicenter of the COVID crisis in the U.S. And thankfully now, our numbers have gone way down, in no small part thanks to frontline heroes like yourself and to great leadership from our governor. We've since seen in at least 12 states a rise in COVID as they began to open. So what can other places learn from us on how to accomplish what we were able to do, which is, beat it into submission?
Yeah, that's a great question. As I've luckily been able to survive this pandemic, specifically working in Queens, which had the most cases out of any other borough in New York City, I have to caution other states where I'm seeing rises. And I think a lot of the success that has been done in New York City is attributable to the community. The education that has been given out has been concise and clear. People are properly socially distanced, washing their hands, continue to wear masks. And it's not a divisive issue here, but I'm seeing that that's an issue in other states.
So, Doctor, yesterday, New York, New Jersey, and Connecticut issued a mandatory 14-day quarantine order for people traveling in from more severely affected states. How do you think they can enforce this? Do you think it'll work?
I think that helping people understand the education of the importance of self-isolation, specifically after traveling from a high infection rate state such as Florida, is important. But I have a lot of caution when we start to enforce this with legal and financial penalties, because I fear that it targets specific communities that are more vulnerable in the first place. We've seen what happens when we enforce certain rules in New York City, when we compare places like communities in Harlem to communities in the West Village, and we had very different outcomes. So I think it's important to share the message, but I do have a lot of caution when we start to enforce that physically on communities.
Dr. Sutton, my home state of Arizona is one of the states that's seeing a serious rise in cases. I'm very, very concerned about the place that I love so much. There are some studies that have pointed to nursing homes and care facilities as a source for these rapidly growing numbers. Is it that simple? And what can I tell my friends in Arizona right now who are scared?
So I feel your fear. Having gone through this, I also have that fear when I see these numbers continue to increase in states and people don't respect the reality that this virus is doing what it wants to do, regardless of where it is. In Arizona specifically, when we talk about the sources, I think one of the causes or sources can be nursing homes, but I do not think that that is the whole source of the issue. There's a lot of discussion over whether or not masks should be worn and what rules should be given for social distancing, and unfortunately, I'm not seeing that. Advice that I would give to people is that if you want to participate in defeating this virus, you can help us by wearing a mask, social distance when you can and be appropriate, and also making sure that you wash your hands and take care of those who are vulnerable.
Dr. Sutton, we are also hearing reports of states comparing their numbers to what New York experienced. Do you think that's a fair comparison?
So I do not think that the numbers specifically compare. In New York, we had some of the highest numbers. Every state deals with their numbers in a different way. And by that, I mean the numbers that are affecting specific communities are dependent on the hospital capacity, the amount of the rate of increase in cases, and the ability for people to self-isolate and get treatment. And so when I look at a state, I don't really look at the numbers. I look at those variables to see how the state or community can handle the numbers.
Dr. Darien, you've been fighting on the front lines of the ER during this pandemic. Now, we've seen footage of people enjoying themselves without masks everywhere, from shops to rallies to bars, a jam-packed pool party in the Lake of the Ozarks. Do masks, wearing masks, really work? Can they really cut down the rate of transmission? Washing your hands, does that really work? What do you say to people who seem to think just because they're over the virus, is it really over?
So I think it's really difficult to try to explain to someone the simple concept sometimes because people feel as though it's a violation on their natural rights. But what I try to advise is that wearing a mask is an act of altruism, is an act of caring and being compassionate that you can have toward other people in your community who are more vulnerable. If you think that wearing a mask may not help, I advise people to look at the effects of New York City and the things that we have done specifically in preventing the resurgence of this virus by doing these simple steps. I think it does work. And the simple answer is I think that everyone who can wear a mask should wear a mask.
Right. So here's a good one. Trump recently said that by having more tests, we have more cases. Duh. And now his administration is cutting federal support from 13 testing sites, including 7 in Texas, a state with rising numbers. What do you make of all that, sir?
The simple answer is frustration and confusion. I don't understand that logic because as a physician fighting this virus, the more tests that you have available, the easier it is to track, isolate, and take care of the people who need taken care of this COVID-19 virus. I now look at places like Florida as people line up on the highway to try and get a test and wonder, how could it get to this level? We're 6 months into this virus. How are we not prepared in these states? And it's likely attributable to the fact that we haven't provided enough resources and preventative measures. And now we're seeing these surges in places where they may not be able to handle it like we did.
Dr. Darien, in addition to the viral pandemic, the systemic racism so pervasive in our country came to a head after the murder of George Floyd. You wrote an incredible article for GQ where you say, I've spent months fighting coronavirus in the ER. Police violence is what really scares me. And that struck me. What has your personal experience been like during this time?
Thank you so much for taking the time to read that. I often, someone recently said something that really struck with me. It is, as a Black man, as a Black physician, I'm fighting a pandemic within a pandemic, one of which is COVID-19, and the other is this pandemic of this realization of racism that has already existed long before my existence. And I have to say that simply, it has been tough, but luckily I have been raised by a brilliant mother and father who have given me the level of strength and resilience to continue through this. And I think that as long as I have my voice and stand on this platform, I'll continue to voice my opinions and help educate people on the realities that we face as Black people.
It doesn't get any better than that.